Well, nearly 30 million people in the United States suffer from varicose veins. Not only do they look bad, but they can be painful as well.
Yeah, here to help us this morning is Dr. David Drawn, board-certified surgeon at Vein Specialists of the Carolinas. Dr. Drawn, good morning. Thanks for being here today. First off, what are varicose veins and how do people get them?
Well, I actually looked up the definition of the word varicose because I've never heard it used with anything but a vein. It simply means swollen or dilated. And the only other time I've ever heard that word used was in a poem talking about the varicose moon. So varicose is pretty much synonymous with enlarged veins. And the only time you'll ever hear it you won't ever hear it mentioned any other way except about veins, but it's basically just enlarged veins.
And how do we get them? How does it happen?
Well, the problem is that the veins have to carry the blood out of the tissues, and they don't have a pump to do it, and they have to go uphill against gravity. So they're little one-way valves, and if those go bad, then back pressure, backflow occur.
So what are some of the symptoms? Do you know, is you symptomatic pretty soon? Would you know, would you get aching? Would you get something that would tell you that you're about to get up?
Well, it's all over the place. Some people have horrible, huge varicose veins and zero pain. Other people have hardly any tiny little spider veins, but their legs hurt terribly. They usually don't describe it as pain. They usually say achy, heavy, tired, restless, cramp, numb, stinging, tingling, popping. They use all these nondescript phrases, but they don't use the word pain. But the vast majority of patients have some type of discomfort or pain.
Discomfort, and then some are, you can see them, and it's very clear that you have varicose veins. As we look at some before and after pictures, Dr. Drawn, I want you to talk about treatments. Again, you're looking at a before and after picture here of the work that they're doing. What types of treatments are available for varicose veins?
Well, treatment for varicose veins has dramatically evolved. Decades ago, it was in the operating room being put to sleep with vein stripping. A decade or so ago, it went to office-based, but we use heat from either a laser or a radiofrequency catheter. And we put a little heated catheter inside the vein and we seal it. Now that heat would be intolerable and be painful, so we had to put numbing medicine all the way down the vein. And that's pretty uncomfortable. But today, the latest thing out uses no heat, no numbing medicine, and just a few little needle sticks, and you can take care of the largest veins you've ever seen with just a few needle sticks.
Much better for a patient then.
Dramatically.
So is there downtime after receiving a treatment?
It has gotten less and less. The old days, it was a week in the hospital or a few days recovery. Then in the office-based stuff was a day or so. Now with this, it's walk in, walk out.
Wow.
So, Doc, when we talk about results, are the patients seeing results immediately? They see that the veins,
Yes.
down quickly?
Yes. There are several layers of veins. So we start with the innermost layer that has a problem, and we work our way out. And so the visible result is when you take care of the outermost stuff. So when you take care of the innermost stuff, you're not going to see a change right away. But you will feel a dramatic improvement in how your legs, the aching and heaviness, that will be almost immediately improved. And then as we progress from the inner to the outer veins, that's when you see all the improvement.
So for people who are watching this morning and for whatever reason, maybe they've been afraid because they're thinking of the treatments of old and thinking, oh, I just don't want to deal with that. That freaks me out. I mean, you would say what to them? I mean, go ahead and give the office a call and give it a try because it's not like it used to be.
Well, that's exactly right. The old, everybody's heard of vein stripping.
Right.
And that's kind of got a bad reputation, and everybody's afraid of that.
This doesn't sound good.
Right. It sounds bad.
Right. It does sound bad.
In reality, it was the first minimally invasive surgery. Instead of a 3-foot incision, you just got it stripped. But stripping sounds brutal.
Yeah.
So now we just use a few little punctures, a few little small needles, and the current latest thing is a foam that we insert into the vein. And that foam damages the lining of the vein. And it only takes a needle to put it in the vein, and then you compress it, and the foam damages the vein seals itself, and goes away.
I would venture to guess patients are thrilled with the results and probably thinking, why didn't I do this years ago?
Am
I right?
Yes, that's exactly the case. Today, veins used to kind of be a little outside cottage industry, not a major medical field. But today we have really advanced technology for screening the veins to find broken valves, and the technology to diagnose the problem, locate the problem, and fix the problem is very simple, elegant, and sophisticated. And it's not this big, clunky, huge, brutal surgery anymore.
Yes, see, that is good to know, right? Call Vein Specialists of the Carolinas. The number is 704-419-8386. I'll say it again. It is 704-419-8386. Or visit treatyourveins.com. Easy to remember, treatyourveins.com. Dr. David Drawn, thank you for your time.
Thank you.
Appreciate it.
Thank you, sir.
Thank you.